What do you usually start? And how do you determine whether you pick an IR, an XR, an Adderall? How do you versus a methylphenidate or a Vyvanse? Like, how do you select what agent to choose?
Certainly. Well, I mean, first and foremost, I would probably start with a longer acting formulation of a stimulant.
Yes.
Because
Adderall XR or Vyvanse.
Exactly. So because people will feel, like you said, you know, it's easier to come up, easier to come down. There's less of kind of a, you know, rapid onset of symptoms and kind of an after crash. So and there is less a risk potentially for diversion and misuse. So I will typically start with Vyvanse or Adderall XR. There are times in which the longer acting formulations can cause problems with sleep, for example. So say, for example, people take their Vyvanse or their Adderall XR and the effects of the medication last for, you know, a longer period than is desired. People aren't able to kind of calm down in the evenings, for example. They're not able to go to sleep at an appropriate hour. That might be an indication to consider instead an immediate release formulation, which essentially just has a shorter window of action.
Yeah. The IRs, the instant release, there's more flexibility. Hey doc, sometimes in the morning I don't need my Adderall. I'm going to the gym. I'm not really doing anything that I need to be on Adderall for. But then again, my classes start at 1 p.m. If I take my Adderall XR, which lasts about 10 hours, I can't take that at 1 p.m. because then I'll have insomnia.